Know your body, know if there's something not right, get it investigated, because if it's a neuroendocrine carcinoma, we need it to be treated quickly, and we want to make sure that people feel well supported. My name is Meredith Cummins. I'm an oncology nurse by background and been looking after neuroendocrine cancer patients since 1995. The understanding of neuroendocrine carcinomas or neuroendocrine cancers is complex anyway, but then when you come to having an extrapulmonary neuroendocrine carcinoma, that adds another layer of complexity for patients. And I think when we're looking at neuroendocrine carcinomas, they are an aggressive type of neuroendocrine cancer, and with that they have very poorly differentiated cells, and they can be found anywhere. Normally it's in the lungs, that's sort of, the predominant ones, but they can be in the skin, they can be in the gastrointestinal tract, so anywhere so from the top of your mouth down to your bottom, in the genital urinary area. The discovery of them is basically through being investigated through other symptoms like weight loss and weakness, so it's harder to be able to diagnose them. There's an index called Ki-67, and normally they have a very high Ki-67, and this actually shows that the mitosis of the cells dividing is very rapid. They can metastasize very frequently, and the prognosis is not good. And because they're so rapid, it's really important that they are diagnosed earlier. It's being really aware of their body, and if something is not right, and making sure that they are actually getting it investigated, and not just sort of sitting back and sort of thinking, oh, well, it might be just a passing pain, or it might be, something that might be a virus or something. If the clinicians are not sure what it is, keep asking and ask to get sent to a specialist who is more than likely going to be able to assist in getting the right diagnosis. Because when you do need to get the diagnosis quickly, they need to be treated quickly. There are a lot of patient organisations around the world. There's actually, with the International Neuroendocrine Cancer Alliance, there's 37 member organisations, and majority of us will be looking after neuroendocrine carcinoma patients. So we have the expertise, the support, the understanding, and we can provide them with a lot more information and help them to navigate the system, because it's a really difficult diagnosis. So there's the uncertainty of not knowing what's going to happen. As far as treatments, there's not a lot of treatments that are actually available. For neuroendocrine carcinomas, it's predominantly been chemotherapy. When patients have got side effects from things like chemotherapy, they really need to make sure that they've got a good relationship with their treating team to let them know about the side effects, because it might mean that there needs to be changes to the treatment. But there might be also ways that we can lessen the side effects and have just ways to prevent. So it's getting the diagnosis and getting the multidisciplinary management team's input, because it is so complex. As far as new treatments, I think we're sort of starting to get a bit of a breakthrough, and there's a lot of research going into clinical trials for extrapulmonary neuroendocrine carcinomas, and new drugs coming. There's targeted therapies where they're looking at those receptors that are on the cells, so that we can then give the treatments that we know are going to be effective for those patients, because they've got the target for us to give the treatment. So we're getting smarter, but we've still got a lot more to do. And there's a lot of the immunotherapies as well that are coming through. Know your body, know if there's something not right, get it investigated, because if it's a neuroendocrine carcinoma, we need it to be treated quickly, and we want to get the best outcomes for people by actually getting the treatments done early. And we want to make sure that people feel well supported, and that they can reach out to people that understand what they're going through. And I think one of the main things is that as far as treatment and everything, we need so many more sort of clinical trials to happen and to target extrapulmonary neuroendocrine carcinomas, because I think some of the things that are in the pipeline are looking really promising, and I think it will give much better hope and a better outcome for extrapulmonary neuroendocrine carcinoma patients and families.